The goal of a headache assessment is to determine which structures are causing the pain of the headache: the bones or joints, the muscles, or the superficial nerves. The first part of the exam is the history, where we ask a series of questions to help determine what type of headache we might be dealing with. We want to know where the headache is felt. Is it on one side of the head or both? What kind of pain? Is it dull, pulsing, throbbing, stiff? When did it start? Is there a pattern to when the headache is present? Is there anything that makes it better, anything that makes it worse, or any specific triggers that bring on the headache? After the history, we go into the exam, where we're going to go through a series of orthopedic tests and joint assessments to determine if the joints or ligaments in the neck are causing the pain. Then we'll go into muscle palpation and muscle testing to determine if the muscles are causing the pain. And then lastly, we'll do nerve palpation to decide if the superficial nerves branching out of the neck and into the head are causing the pain of the headache. Here are the joints of the neck. We have the first cervical vertebrae labeled C1, the second cervical vertebrae labeled C2, and the third cervical vertebrae labeled C3. This is the base of the skull right here. This is part of the brain. What's in red are some muscles, and then these orange tubes are an example of the nerves branching off the spinal cord. The joints of these cervical vertebrae can cause headaches, and this one circled here between the second and third vertebrae is one of the most common joints involved in cervicogenic headaches. You can see these nerves branching out, and in the next photo, you can see where they innervate or provide sensory sensations such as pain, hot, cold, numbness, tingling to the back, kind of top of the head, and the side of the head and neck. Here are some of the muscles that can cause pain in headaches. We have the back of the head right here, the back of the skull, and then a deep layer of muscles that connect to the top three vertebrae. This here is the first cervical vertebrae, and then we have the second and the third vertebrae, and the muscles that attach and can get tight and cause pain at the back of the head and the neck, and these can refer up over the back of the head and even into the back of the eye. Here we can see the superficial nerves that branch out from the back of the head and neck, and they can travel up the entire back of the head here, and then some of them branch out from the side and can travel up behind the ear and underneath the ear. And these nerves, as you can see, if the muscle is tight and inflamed, these nerves could be irritated and could contribute to pain. If the exam shows that the headache is not caused by the bones, joints, muscles, or nerves, then a longer history can be done to help tease out any triggers that might be causing the headache, such as dietary or nutrition sensitivities, or environmental factors such as stress, poor sleep, screen time, maybe an outdated eye prescription, or any other potential causes. If the exam shows that it's not the bones, muscles, and nerves, then the chiropractic care we provide in office might be less focused on the physical care, such as the adjusting, the muscle work, and the exercises, and might focus more on lifestyle modifications for potential dietary or environmental triggers. We might recommend other treatments such as acupuncture, or provide referrals to other providers such as an eye doctor or a naturopath. Whether your headache is a tension type headache, cervicogenic headache, or a migraine, the most important part of the assessment is to determine which structure is causing the pain: the joints, the muscles, the nerves, or which triggers are contributing to the headache. Once we know which structure is causing the pain of the headache, we can move into the in-office treatment, which we will discuss in the next video, so stay tuned.